Hello and welcome to Addressing Cancer Survivors' Needs After Treatment, an Introduction, a training webinar for patient navigators. My name is Jennifer Bretsch, and I'm a project manager in the Division of Cancer Survivorship at the George Washington University Cancer Institute, or GWCI, located in downtown Washington, D.C. I am joined by my colleague Liz Hatcher, who serves as our survivorship patient navigator. Thank you for taking time out of your busy schedule to improve your knowledge and skills to help patients after they have completed their treatment for cancer. Our hope is that in less than an hour's time, you will have a greater understanding of the issues cancer survivors face after completing treatment and insights into resources navigators can use to assist survivors. The information we will share should build upon and reinforce what you already know and how you currently help patients. This webinar will set the foundation for a second webinar training, which will be a live event in August. Additional details will be provided to you via email. Turning to this webinar and the learning objectives. At the conclusion, you should be better equipped to describe the state of cancer survivorship in the U.S., describe how the American Cancer Society and the George Washington Cancer Institute are collaborating to advance the field, identify key concepts important to post-treatment survivors, and identify resources navigators can use to guide post-treatment survivors. We'll spend most of this training addressing the third and fourth learning objectives and encourage you to review the entire training. Please note that there is a post-training evaluation. Please look for that in a follow-up email. Your feedback helps ensure that we can improve future trainings, and we will take your comments very seriously. So why has there been an increased focus on cancer survivors? Well, there's a rapidly growing population of survivors due to advances in diagnosis and treatment. There are approximately 12 million cancer survivors in the U.S. and 20 million globally now. There are predictions that there will be 20 million in the United States by 2020. 62% of adults diagnosed with cancer today can expect to be alive in 5 years, and 75% of pediatric survivors are expected to be alive after 10 years. There's also greater emphasis on patient-centered issues to improve quantity and quality of life, and there are increasing expectations by patients for good quality of life. So as you may have noticed from your work, healthcare systems and the public health field are also placing greater emphasis on survivorship. So who are cancer survivors and what does cancer survivorship mean? Well, the terms have different meanings to different people, and how to refer to this growing population has stirred some controversy. Many people consider a person to be a survivor from the moment of diagnosis. In recent years, this view has become increasingly prevalent. Some, however, think that a person with a cancer diagnosis cannot be considered a survivor until he or she completes the initial treatment. Others believe that a person is a survivor if he or she lives 5 years beyond diagnosis. And some reject the term survivor entirely. Regardless of the term used, the fact remains that the number of people living or surviving cancer has increased dramatically in the past few decades, and that's really great news. Along with that growth, a cancer survivorship advocacy community emerged and identified physical, psychosocial, spiritual, economic, and legal issues related to cancer. And as part of the expanding community, the National Coalition for Cancer Survivorship, or NCCS, was founded in the 1980s. Today's concept of cancer survivorship, as broadened by definitions from NCCS and the National Cancer Institute, can be traced to a 1985 New England Journal of Medicine article by Dr. Fitzhugh Mullen, who is a survivor and one of NCCS's founders. Let's turn to the concerns, challenges, and problems that people surviving cancer have reported during surveys. Here we have the top 5 cancer-related problems reported to the American Cancer Society in a nationwide survey a few years ago. Along the x-axis are those 5 problems stratified by the number of years since a person's cancer diagnosis, and each one is a different color. Along the y-axis is the percentage of the people that reported each problem. These results are part of a large-scale series of studies conducted over many years by ACS's Behavioral Research Center, led by Dr. Kevin Stein. More than 15,000 cancer survivors participated with a range in cancer diagnoses. As you can see, these are important findings, but they represent just a very small portion of the survey research that the American Cancer Society conducts with survivors. I have to wonder, do these results mirror the concerns expressed by the patients you work with? Well, let's take a look at what else survivors are telling us. Livestrong has also conducted a series of surveys with survivors, with a particular focus on the physical, emotional, and practical concerns encountered after the end of cancer treatment. Here you see that nearly everyone that responded had at least one concern, and the top 6 concerns were led by fear of recurrence. It was a top concern in the American Cancer Society studies as well. Half of those surveyed also reported that their emotional and practical needs were not sufficiently met. A message like this from survivors points to the important role that you as navigators can play, even after treatment for cancer ends. Because Livestrong has surveyed the survivor population twice, first in 2006 and again in 2010, the results can be compared as shown here. Unfortunately, the receipt of care for physical, emotional, practical concerns decreased between those two time years. For physical concerns like pain and sexual functioning, to name just 2, the percentage of survey respondents who received care for those concerns dropped from 73% to 58%. For emotional concerns, those that reported receiving care decreased by 5 percentage points. And for practical concerns such as finances and health insurance, only a remarkable 24% received care in the 2010 survey, down from the 40% reported in 2006. Well, a note about how the Livestrong studies were conducted. First, these results generated were independently selected groups of survivors, so the same survivors were not necessarily polled twice. And care, for the purposes of the Livestrong surveys, was defined very broadly, not limited only to health care provided by professionals like physicians or nurses. Rather, the definition includes a wide range, such as family, other cancer survivors, religious leaders, and support groups, among others. So given these findings, what role could you as a patient navigator play? Navigators can continue to problem solve with survivors and help remove barriers so that they get the care they want and need. I very briefly introduced what we hear from survivors and what they say does make a difference. One such way is helping to create a groundswell for national action. In the past 8 years alone, the national reports you see here have been the catalyst for continuing to improve the cancer survivor's journey. Each report was developed collaboratively by leaders and experts in the cancer community, ranging from government agencies like the U.S. Centers for Disease Control and Prevention to leading advocacy organizations like Livestrong. These reports have been out for a few years, so you may be wondering, well, what's new and why is there even more attention on cancer survivorship? Well, to bring us up to date, let's consider the national level forces that are drivers specifically related to patient navigation and survivorship. First, we look to the Commission on Cancer and new standards that will be phased in 2015. As you may know, the Commission on Cancer accreditation program was designed to ensure quality in the programs providing care. Programs could be offered by hospitals, freestanding treatment centers, or integrated healthcare networks, and periodically the Commission on Cancer updates its standards. In the latest round of updates, the COC will require that each accredited organization develop and implement a process for providing a comprehensive care summary and follow-up plan to each patient who is completing cancer treatment. Related to patient navigation, in 2015, an accredited organization should provide navigation services either on-site or by referral, as well as track the progress for doing so. And as for the Association of Community Cancer Centers, the current standard published in 2009 has a guideline that states an optimal comprehensive cancer program should make available information and programs specific to survivorship issues to cancer patients and their families. And the ACCC includes some guidance and details about implementing this guideline. Well, I think it's fair to say that these standards have created and will create an even greater demand for the work that you do as a patient navigator to assist people after they have ended treatment. Before I turn the training over to Liz, I'd like to take a few moments to tell you about the National Cancer Survivorship Resource Center and how the American Cancer Society and GWCI are collaborating. The Resource Center is a new national initiative with the purpose of increasing the quality of life for survivors, caregivers, friends, and family, as well as improving survivorship knowledge of healthcare professionals, community-based and government organizations, as well as policy and decision makers. We're working to advance survivorship as a distinct phase of cancer care, with particular emphasis on those individuals who are transitioning from active treatment. Well, why are we doing that? Well, the transition period is really a neglected phase of the cancer care trajectory with the potential for the greatest impact. It's activities like this training and future activities to address healthcare systems and policy change that comprise the Resource Center, rather than a physical place to visit. And our work is supported by the U.S. Centers for Disease Control and Prevention. We're in the first year currently, and we're working with national experts to identify and develop strategies to mitigate challenges that occur in that transition to post-treatment. And we're also laying the groundwork for the next couple of years. In this first year, we're really focusing on identifying gaps in survivorship information, content, and delivery methods, as well as identifying performance indicators to assess the effectiveness of survivorship activities and programs, as well as supporting cancer survivors and caregivers through survivorship navigation. The Resource Center initiative seeks to implement recommendations set forth in those landmark publications I mentioned, and it's what led to the development of this training and providing it to you today. The Resource Center efforts include collaboration with many survivorship leaders and organizations, such as Livestrong, nationally recognized cancer centers, and leading oncologists and cancer researchers. 4 work groups of experts from around the country have come together to address survivorship. One work group is specifically focused on survivorship programs and navigation. Since you all are the boots on the ground and work directly with patients, we really would love to hear your ideas about how together we can improve the support of cancer survivors and caregivers through survivorship navigation, education, and resource referral. And we'll provide our contact information at the conclusion of this webinar so you know how to get a hold of us. Well, with that background information about the state of cancer survivorship in the United States and how ACS and GWCI are collaborating, it is now my pleasure to introduce my colleague Liz Hatcher, who will discuss issues that survivors face after treatment and resources you may find helpful. Liz serves as our Survivorship Patient Navigator at the GW Cancer Institute, as well as a citywide patient navigator in a network of navigators at diverse treatment sites throughout Washington, D.C. She is the co-staff lead for the Quality of Life Programs and Navigation Work Group. She is a registered nurse and facilitates support and educational programs for cancer survivors transitioning from active treatment to survivorship. Prior to pursuing her career in nursing, Liz conducted extensive customer service trainings for an international exchange organization. And it is now my pleasure to turn things over to Liz.
Thank you very much, Jennifer. As Jennifer mentioned, I'm going to be discussing some of the issues facing cancer survivors. And cancer survivors may face many challenges after treatment ends, depending on their particular diagnosis, their treatment regimen, and their overall health and life circumstances before and after diagnosis. We'll discuss these 5 particular issues that have been described as common concerns for cancer survivors. We'll be discussing late and long-term effects, financial concerns, fear of recurrence, nutrition and physical activity, and also discussing care plans. And we're going to focus on describing these issues and also on ways that navigators can assist patients and resources that they can help them with. So late and long-term effects will vary for the individual depending on their treatment. And late effects occur after treatment has been completed. They'll appear later. Long-term effects are effects that are persisting after completion of treatment that the survivor may have been experiencing throughout treatment. And it's important to emphasize that not every survivor will face all of these things, so they should be speaking with their healthcare team about what they should particularly be looking out for. Patients often say that they weren't prepared for late and long-term effects, so if you and the healthcare team can help prepare the patient during diagnosis and treatment, it can be helpful for them to know what they're facing and be prepared and have coping strategies in mind. That said, many survivors do report memory and cognitive changes and fatigue as some of the top two, as we saw in the Livestrong data. So we'll go into more detail on those in the next few slides. But other late and long-term effects can include swelling, pain, neuropathy, sexual function, weight gain, and others such as heart symptoms, hormonal problems, and bone loss, depending on treatment regimen. So the memory and cognitive changes we described earlier can also be known as chemo brain. And these can be problems with word finding, multitasking, calculations. Some survivors will describe having difficulty calculating the tip at restaurants or learning new material. Some will see improved functioning in 6 to 12 months after treatment ends, but others will see some improvement and then may plateau. So it may be an ongoing issue for many survivors. We know that anxiety, depression, early menopause, and sleep disturbances may impact cognition. So what are some coping strategies that survivors can use when dealing with chemo brain? They can try to reduce distractions at work, utilize smartphones and GPS technology if they're having problems with directions, treat their anxiety and depression and other issues such as sleep disturbances, which definitely affects mental performance, taking breaks from tasks, organizing their schedule to reduce demands, and avoiding multitasking. They may need to be more deliberate, focus on one thing at a time, and that can be a tough adjustment for somebody who's used to multitasking and doing 1,000 things at once. So that may be a big adjustment for somebody. And they should discuss reasonable accommodations they may need from their employer. We'll discuss this a little bit more later with the financial slides, but they may need to have a more quiet space at work to get things done because of they may be more easily distracted. Fatigue is another very common late and long-term effect, and the duration, again, may vary considerably. And there may be other factors involved that may contribute, such as depression, early menopause. Pain can be a big factor in fatigue. Sleep disturbances, changes to the immune system, anemia, cardiovascular disease. And so the causes aren't fully understood. Emotionally, physically dealing with so much in this transitional period may impact, their level of energy. And they may not be prepared to not be back to 100% after treatment. Many survivors describe that they thought they'd be able to get right back as soon as they were, cleared, that they would be back to 100%. And so they may try to do too much, get back to that multitasking, and that may increase their fatigue. So some coping strategies for survivors facing fatigue. Increasing physical activity has been shown in many, many studies to reduce fatigue. And it may seem counterintuitive to a survivor who's feeling tired that they should be exercising more, but I think it's important as navigators to bring that up because it has been shown to really help. Anything they can do to increase their physical activity as they're cleared by their physician can be really helpful. They should schedule appointments and activities to maximize their available energy levels and ask for help. They have to acknowledge, it's important as navigators to encourage them to acknowledge that they may not be able to do it all right away and may need continued support from friends and family. It's important to validate these concerns and encourage communication between survivors and their support system. So when dealing with late and long-term effects, when the patient is experiencing pain or other symptoms that may or may not be a late or long-term effect, it's important as navigators to encourage communication with the healthcare team. They should be talking to the healthcare team about what they should watch for in terms of late and long-term effects, as their particular treatment would dictate, and ways to treat these, ways to help. It may be a good suggestion to have them track symptoms in a journal. That can help communication with the physician. Noting symptom onset, when did the pain start? Location, where are you feeling the pain? Duration, how long does it tend to last? Characteristics, is it sharp, dull, throbbing? Aggravating or alleviating factors, such as, exertion makes it worse, rest makes it better. Any related symptoms, any nausea or other symptoms that also go along with, for example, the pain. Radiation, does the pain seem to move? Do they feel pain initially in one area and then in another area? Timing, time of day, tends to be worse in the morning, tends to be worse at night. And the severity, looking at the pain scale or any other symptom scales. If patients can track this information in a journal, it may allow them to have a better conversation with their healthcare team. Patients often report feeling rushed or unsure how to explain what they're feeling to physicians, so a journal can really be helpful, especially if they're also experiencing memory issues and cognitive issues. Writing things down can really be helpful. Other tips for managing late and long-term effects: talking to the oncology team about how often they need to come in, how often they need to be checked. Keeping the primary care physician in the loop. The primary care physician should have copies of all medical records and treatment regimens and know the potential late and long-term effects that should be screened for. This may require the patient who's able to advocate for themselves to be an educator to their primary care physician. But also the oncology team should help facilitate that. Keeping scheduled screening appointments, mammograms, bone scans, cholesterol screenings, echocardiograms if they have the potential for heart effects from their chemotherapy or radiation rather. All these things Navigator should help them know what they need to be doing and communicate with the healthcare team, and then also helping adhere to follow-up. Another major issue we see working with survivors are financial issues. After cancer treatments, survivors may be dealing with outstanding medical costs, reduced income, and other financial burdens that may have existed before the cancer diagnosis and may have been worsened by the cancer treatments and diagnosis and their ability to work. And you may be able to draw on some of the same resources you use for patients in treatment, but there are many charitable organizations that restrict funding to those only in active treatment. So you may have to be a little bit more creative and also know what resources are out there in your particular community for any individuals who need assistance, regardless of whether or not they've had cancer. So I'm sure you're very familiar with Social Security, SSDI, SSI, and getting patients qualified for that. And as you also know, it's fairly common to be rejected for disability the first time a survivor or a patient in treatment applies. So you may want to encourage qualified applicants to reapply and appeal and assist them with getting all the proper documentation. Survivors will face many return-to-work issues if they're able to do so. And I just want to reference the Cancer Legal Resource Center's website. They have a manual for healthcare professionals that gives great information on all these issues, and they provide webinars to train on these issues. So just some of the things that can protect survivors and provide them with resources are the Americans with Disabilities Act. It was amended in 2008 to make it easier for someone with cancer to use ADA protection. And what the ADA does is it prohibits discrimination against qualified employees with a disability who can perform the essential functions of their job with or without reasonable accommodations. So with this amendment, and it depends, it's all on a case-by-case basis, and it has to show substantial impairment, but a person who had chemotherapy and has difficulty concentrating and thinking may qualify as having a disability under the revised ADA and get access to reasonable accommodations. And the Family Medical Leave Act can be really important, especially if somebody's going through treatment. So you may be very familiar with that. But knowing, and it depends on how long an employee's been with their employer, how large the employer is. So the Cancer Legal Resource Center website is a great place to just take a look at those issues. And knowing what survivors might be qualified for job accommodations, and reasonable accommodations are something employers are required to do as long as it doesn't create undue hardship for them if a person is qualified. And those can include telecommuting and modified schedules, which can be really helpful for survivors who are still dealing with the impact of cancer treatment. So the website is a great resource, and they also have an 800 number that patients can call. And just looking at, some of the simple things, like helping a survivor, take a look at their resume if they're going back to the workforce, and maybe organizing their work experience by experience rather than time, to sort of, minimize the obvious gaps in employment. But again, the Cancer Legal Resource Center and Cancer and Careers have some great information on that. Health insurance can be a big issue, and we could certainly do a whole training on those issues, but I just wanted to provide some resources and things that you may need to reference for survivors. And of course, this all can vary by states, this information. And it's a good resource is the community clinics. Knowing what's in your community that will do primary care for people who are uninsured, that can be really helpful to cancer survivors. So here's a list of some assistance organizations and resources. I've mentioned already a couple. Just to highlight, the Patient Advocate Foundation, they have case managers who can help patients negotiate with hospitals and provide some copay assistance for certain diagnoses, even 12 months retroactive. So even if they've been out of treatment, the Patient Advocate Foundation can certainly help. And then knowing your state and local resources. Energy assistance programs are ones that I access for survivors all the time. Knowing what your utility company offers and then other state programs is really important. Vocational rehabilitation services, counseling services, and then offices on aging. Those can provide transportation, meal services, and coordinate social services for seniors. So those can be great resources for your post-treatment cancer survivors. All other resources, 211, United Way service that provides information on community resources. Catholic Charities, other faith-based charitable organizations may be able to provide assistance. Salvation Army can provide assistance in many locations. And Patient Services, Inc. and Healthwell Foundation, they assist with copays for some diagnoses, but it may actually be more helpful with if a patient has a comorbidity that may qualify. So just looking beyond just their cancer diagnosis and history with cancer to find resources can be really helpful. So now we want to talk a little bit more about fear of recurrence. It's definitely a top concern for patients who are transitioning out of treatment. And I think it's important as navigators to acknowledge that completing treatment can be both stressful and exciting. And patients want to know, what is my risk for recurrence? And of course, that's different for each person, depending on the type of cancer, how long since treatment. And so the patient should, if they're concerned about that, have a dialogue with their oncology team. And those questions and a lot of the resources I'm going to discuss here are available in the ACS Fear of Recurrence packet that we'll also provide reference to at the end. But it should be a conversation with their healthcare team. And I think, it's important to acknowledge that nothing will guarantee that cancer does not recur. However, eating right, exercising, and following up with the medical team are important to possibly prevent, detect early, and or make a survivor better able to fight recurrence. So, you don't want to provide false hope, you don't want to be pessimistic, but as navigators, I think we can really empower patients to maybe feel more in control of their overall health and make positive changes that can potentially, reduce their risk for recurrences. So you want to validate concerns. Common feelings after treatment: feeling anxious, feeling sad, feeling guilty that they may not be able to assume their role again right away, and for all the help that they received, emotionally exhausted, fatigued, and fearful. And we want to emphasize that, although these are common feelings and you want to validate them, we also don't want to gloss over them. If these are concerns that are really emotional distress and require further evaluation, we want to make sure that they're speaking with the right healthcare professionals, and we'll talk a little bit more about that later and provide additional resources for that. But I do think it's important to understand that there is a chance that cancer could come back, and I think that it's been said that the healthcare team may not necessarily want to talk about this with patients. They may be trying to protect patients, assume the patient already knows this. They don't want to seem pessimistic, and they may also want to share in the moment of victory. So I think it's important as navigators not to gloss over those fears and those concerns, and acknowledge them as being very real. So coping strategies. I think we can encourage coping strategies for patients, and just really encourage them to be actively coping with all the emotions that they're feeling after treatment ends, not just fear of recurrence. So one strategy that was presented on the Cancer Care Survivorship Series, Coping with Stress webinar that I listened in on, was presented by Dr. Spiegel. And it uses this FACES, and so it's starting with face the issue. Face rather than flee. The patient will feel less helpless dealing with emotions and stress. Altering perception, creating a positive mental image, or positive self-statements, mantras or meditation, guided imagery, whatever might work for your particular patient to help them just feel a little bit calmer, maybe alter their perception of the situation. Active coping, identifying the problem, developing a strategy, getting more information, putting a plan in place to help them cope. Expressing emotions, not wanting to bottle it up. Survivors may feel like they don't have a right to be sad anymore. They've been told no evidence of disease. They don't, but they should still be able to express these emotions and communicate that. And seeking social support, finding other survivors, other groups, other counseling, whatever they need to be involved with that can help them cope with these emotions and this stress. Because cancer can be isolating, and they may continue to feel that isolation in the post-treatment period. So it's important to help them connect with social support. So patients will often ask, when should I call the doctor? Is my cancer back? And this list of symptoms is from the ACS Fear of Recurrence resource. And I think it's just generally important, if a patient is having an unusual symptom, that they can't explain, or something that their doctor or nurse told them to look out for, they should certainly contact the healthcare team. We want to make sure that they're facing this, they're not in denial when these symptoms are occurring. So there's just a list of, certainly major triggers that would need to be addressed by the healthcare team. May or may not mean that cancer is back, but they should be addressed. And then here's a list of some national and local resources. Knowing the support groups in your area can be really important. Cancer Care, as I mentioned, provides webinars, a survivorship series, and they also have oncology social workers available via phone 24 hours a day for somebody who's dealing with these issues. So as Jennifer mentioned, there will be an additional webinar provided at a later date in August, and we really, in that webinar, want to go really in depth on fear of recurrence, because it's a huge issue working with cancer survivors. And we as navigators don't want to be another barrier to treatment. We want to make sure that we're getting people to the person they really need to be speaking with if they're feeling emotional distress, any signs of depression. And if you're unsure, talking with your supervisor or others in the healthcare team you work with to make sure that the patients that you're working with are getting these issues treated, because it certainly is a very big deal. So we'll be providing additional training on the types of healthcare providers that can assist cancer patients with emotional issues, diagnostic tools that healthcare providers use to assess for emotional issues, guidance on the signs and symptoms of emotional distress, and when to refer to those specialized healthcare providers, and how we as navigators can effectively link survivors with the best suited professionals at their institution, if they are having these feelings that need to be addressed further. And there'll also be a Q&A on that presentation, so you'll be able to ask questions regarding these scenarios. So now I want to talk about nutrition and physical activity, and this is a big topic for cancer survivors. The American Institute for Cancer Research, that has a lot of great resources on nutrition and physical activity, they estimate that 1/3 of the 1.5 million yearly cancer diagnoses in the U.S. could be prevented by following diet, weight, and physical activity guidelines. So that's pretty big, and the National Cancer Institute estimates that at least 35% of all cancers have a nutritional connection, and so when lifestyle factors such as smoking and exercise are included, the associated risk becomes much stronger. So this becomes a big issue, particularly because the transition from active treatment to survivorship is a really teachable moment for a lot of survivors. They may want to be taking some active approach to preventing recurrence, to getting their life on track. And so a lot of survivors that I come in contact with are really open to what can they do, what should they be eating. And so I think it's important for navigators to be informed on nutrition and also know, what questions would be best served by another professional. There's a lot of media and research that gets out there on nutrition and cancer prevention. Just a couple examples. There's been a lot of talk about vitamin D and also sugar. There's a New York Times article recently on that. It's important not to be giving dietary advice, but to be aware of what's out there to handle questions from survivors. They are in that teachable moment and looking for answers. So you want to just know what's out there, and just generally, if somebody's talking about taking a supplement or what should they do about this or that, referring them to a dietitian, or certainly if they're taking a supplement, they should speak with their physician first. And, research has shown that being overweight or obese increases the risk for many cancers. And alcohol use also increases the risk, especially when combined with low intake of folic acid. And there are a lot of studies on this, and it's not necessarily clear exactly how obesity increases the risk for cancers, but it's been shown in many different studies. So ACS's nutrition materials provide tips for survivors or just anybody looking to prevent cancer. And those include maintaining a healthy weight throughout life, balancing intake with physical activity, eating 5 or more servings of a variety of fruits and vegetables, whole grains, limiting processed and red meat consumption, and limiting alcohol use. And I think the ones that really come up time and time again are just, really focusing on how can people incorporate more fruits and vegetables into their life. And it may require navigators to really strategize with people, what within certain income levels, how can you get more fruits and vegetables into your life? And for the alcohol recommendations, if you drink alcohol, women should have no more than 1 drink per day, men no more than 2 drinks per day. And the AICR builds on these recommendations for nutrition. They include similar recommendations and also say avoid sugary drinks, consume fast food sparingly, if at all, eat mostly foods of plant origin, avoid processed meats altogether. Those are cured meats, and red meat is also limited, and limiting consumption of salt, they also emphasize. And everywhere you see it, you want to encourage people to intake nutrients from food rather than from supplements. I think, the more they try to isolate what's good and, what the particular, molecular structure that makes the food so great, the more they realize that it's not just that alone. A lot of it's the combination of how things work together. And survivors will bring a lot of nutrition questions about soy, alcohol, red meat, organic foods, and we want to provide you with an opportunity to speak with our dietitian here who works with our oncology patients and survivors. So she will also be available on the call in August to answer any particular questions you might have to the best of her ability, because we know that this is an area where a lot of questions come up from survivors and a lot from navigators and professionals, and we certainly could do a whole training just on nutrition alone. So with physical activity, first you want to encourage patients to talk to their doctor about any physical limitations that they may have. But, here's just a laundry list of the benefits of physical activity. And, you can see in there better sleep, fewer symptoms of fatigue, better clarity in learning. So, once again, when people are experiencing these late and long-term effects, physical activity can be really important and can, reduce their weight, which, can help them potentially avoid recurrences. So it's something to really emphasize. And, these guidelines are from ACS as well. And, it seems like in some ways it goes without saying, but it definitely doesn't. I think it's also important to strategize with survivors as exactly how they can increase their physical activity. Walking just around the block without being completely fatigued is a good goal for, to get started. And, how can they progress from there? Limiting sedentary habits, and just finding ways to incorporate more movement, using a pedometer, trying a new activity with a friend that's a physical activity. That can also help for social support. Taking the stairs, just the little things that, survivors can keep track of. And keeping a log, we've said before the emphasis on writing things down, but a physical activity log can be really helpful too. So they can see their progress as success. So now I'm just going to talk briefly about care planning. And this is a major topic and something that came out of the IOM report. Because we want patients to know what the plan is going forward. And so the American Society of Clinical Oncology has follow-up care guidelines, but they don't have standardized guidelines for all cancers. But patients should have a record of their care, treatment summaries that, what medications did they get and what should they be on the lookout for, and a written follow-up plan of care. How often should they be coming in? What will be the plan going forward from their oncologist? And as navigators, we can encourage patients to ask for their oncologist to provide this guidance. And we also can discuss with them general health promotion and prevention strategies, diet and exercise, smoking cessation. I think it's, really important to assess for if they are smoking, how can we connect them to smoking cessation resources in the community so we can help them quit. Flu shots, CDC recommends flu shots for cancer survivors. Sunscreen use, osteoporosis prevention, virus protection, HPV can cause cancers. And then making sure they're getting other cancer screenings. If they had breast cancer, they may be so focused on that and their mammograms. But do they also need a colonoscopy? Do they also need other tests? Making sure that they're getting those recommended screenings and have a plan to do so can be an important topic of care planning. So now here are some templates that we have for survivorship care planning. ACS has a cancer survivorship care plan. Livestrong has one. Journey Forward has a really user-friendly website. Survivors can build a treatment summary and look at resources there. And health professionals can use that site to build a care plan. And it has a lot of great resources for survivorship care planning. So it would definitely be a good resource. So we just want to review what we've discussed today. We've talked about how cancer is now often viewed as a chronic disease, and that cancer survivors after treatment have many unique needs and concerns that patient navigators can assist with. And hearing about survivorship issues during treatment may help patients prepare for the next phase. I think that's really important. And just to give you an introduction, we've discussed how ACS and GWCI are collaborating with national experts to advance the survivorship field. So now I'm going to turn it back over to Jennifer.
Thank you, Liz, for providing such a comprehensive introduction to help navigators address patient needs after treatment. Navigators, we encourage you to listen to this recorded webinar again as needed, because there was so much good information provided. To supplement the information, we will email you a document that has information on the resources and organizations mentioned during the training, and many more that we think you'll find useful. Each resource includes a direct web link to the resources, as well as a description, and it also includes the name, phone number, and website for the organization that created it, when available. Well, how can you get this resource compendium? We'll email it to you after July 22nd. We're also very interested in how helpful it is to you and ideas that you have for improving the compendium, so please be sure to get in contact with us and let us know. And how can you do that? Well, here's our contact information. Liz and I are both included, but there are many, many people at the American Cancer Society and the George Washington Cancer Institute, as well as other organizations that are contributing to the survivorship initiative. So in closing, survivors require appropriate long-term health care and a focused public health approach to prevent, detect, and provide early interventions for the consequences of cancer and its treatments. Thanks to a more coordinated healthcare system and the efforts of patient navigators like you, cancer survivors have more and better opportunities to have their needs met while in treatment and beyond. So thanks for all you're doing to make it happen. On behalf of Liz and everyone at the American Cancer Society and GWCI that contributed to putting this training webinar together, thank you so much for participating. This concludes the webinar.